welcome to Move Well, Live Well. We get a number of people that come in here with issues regarding their thigh. Even hip pain, knee pain, thigh pain, burning, numbing, tingling, and sometimes even weakness in the quadricep muscles of the thigh. And they're experiencing, what's going on is they're experiencing entrapment of a couple of the nerves that innervate the thigh. One of them being the lateral femoral cutaneous nerve, causing Meralgia Paresthetica, and the anterior femoral cutaneous nerve, which innervates the front of the thigh to the knee. Now I brought out good old Netter here. I brought out Mr. Netter, the Atlas of Human Anatomy here, the second edition. Have you see that? See that there? Brought out Netter. Okay, and so this is a great picture right here. Let's just go to this one right here, the ones with the colors on it. So you see here, this is the innervation of the lateral femoral cutaneous nerve, and entrapment of this nerve will mess up some of the innervation of it. And you kind of see it's the thigh here, and it's mostly the lateral part of the thigh. Sometimes in that pocket, you know, where you put your hand in your pocket right there, all the way down to sometimes the knee. And then you have the anterior femoral cutaneous nerve. You see it innervates the front of the thigh here in blue, and it goes all the way to the knee. Now, the anterior femoral cutaneous nerve is also, that's the cutaneous branch of it, but it's a branch of the femoral nerve. So sometimes you'll get weakness in the quadricep muscles because the femoral nerve innervates the quad muscles. So you'll get some weakness in the thigh muscles themselves sometimes with entrapment of this one. So how do you fix that? How do you fix this nerve entrapment? Well, there's an awesome super duper ice cream scooper stretch that you can do to open up the hip, the thigh, the knee. And it's probably one of the most underutilized stretches out there. Why? Because it doesn't feel good. So most of the time when we stretch our thigh or our quad, we just put our, we kind of do this. And you see people doing this number, right? They're doing this, and this is how they stretch their thigh. And there's not a whole lot going on here, but check this out. I've set up the good old plyo box here. You can use a wall at your house. If you're at the gym, yeah, it's good. You can use a wall at the gym as well. But I just set up the plyo box here. And you should also have some sort of support. I have a smaller box here for support. You can use a chair for support. I also brought out my PVC pipe for support here. So what I'm going to do is I'm going to place my shin and foot up against the wall. So I'm going to have my knee here. See this? My knee is up against that corner of the floor and the box. And make sure that your knee is up against something. The floor is kind of cush. You can put a pillow, whatever it is, underneath your knee so that way your knee doesn't get destroyed. And I like to put my foot kind of inward a little bit like that. Now, I'm going to go into a lunge on this side. Can you see this? Mm-hmm. It's a lunge on this side. And I'm going to take my box and I'm going to slowly prop myself up here. Sometimes for a lot of folks, this is stretching enough. You can feel a good stretch in here just like this. But the idea, over time, you want to be able to get more and more upright. So I'm going to take my box here. I'm going to prop myself up like this. And when I do this here, I don't want to go into extension. See? I don't want to go into lumbar extension. I want to go into hip extension. You see that? See, now you can kind of see my back is staying relatively flat, but my movement is in the hip and it's in the knee. See that? See, no, hardly any movement here, but it's in the hip and the knee. Right there. Boom. And that's, man, I can really feel the front of my thigh there. I can feel the top part of my hip opening up in the front here. Woo. I can feel the knee. Also, all this really open up and through here. And I can even do contract, relax through this. So I can start with one where I'm pushing my foot up against the wall. So 1, 2, 3, relax. 1, 2, 3, relax. And I can get farther and farther upright doing that. Or I can push my knee toward the floor. And you're doing a little bit of hip flexion, contraction of the hip flexion, hip flexors. Oh. 1, 2, 3. Oh. Now you can get more and more upright. If you really want to get upright, then you can use a stick. I get my PVC pipe here, and I can prop myself up here. Can you see that? Yeah. So I can get farther and farther upright doing this. Man. Whew. Now, how long do you hold these? This one may take you some time just to get in position. So again, once you get into position, you get to a good comfortable position here, you want to hold this here for minimum 30 seconds to a minute. I say up to 2 minutes working in here, just like this. And again, it may feel uncomfortable. If it feels really, really uncomfortable, you may have to back off. You can lean forward a little bit. And then over time, you test that, being able to be more and more upright in through here. And so, when you're done with that, half a minute to a minute, I say work up to 2 minutes. Switch sides, and then when you do that, sometimes when you switch sides, you'll notice a big discrepancy. Sometimes a really big discrepancy on one side versus another. And I'm more tighter on my left. That's why I demonstrated it on my right. It just looks, it looks better for me to do it on my right side than my left side looks. So even me, I've got a lot of imbalances that I need to work on. So if I do, I know you do too. So femoral nerve and lateral femoral cutaneous nerve entrapments in there, causing pain, tightness, sensory issues like burning, tingling, numbness in through there, even weakness of the muscles. Hip, thigh, knee pain, done in one super duper ice cream scooper couch stretch. And I know you have couches. So anyway, if you have any questions with this video, drop it off in the comment section below. We thank you for watching. We appreciate it. If you're new here, hit subscribe. And when you hit subscribe, make sure you hit that bell notification button, because that'll keep you in the loop with subsequent videos coming here in the near future. And that way you can continue to move well, live well. Also, I know you know folks who are experiencing hip, thigh, knee pain, and they may have Meralgia Paresthetica or femoral, anterior femoral nerve, anterior cutaneous femoral nerve entrapment. Share this with them. Sharing is caring. That way they can utilize this particular move, exercise, to make it all go away. Also, give us a thumbs up, give us a like. It lets us know you care. Anyway, we thank you for watching. We appreciate it. We'll see you next time. Take care. Bye-bye.